Hey everyone, this is Ed. Welcome to episode 5. We are doing Anatomy of a Startup and we're working with Mila Health. And we promised you in episode 5 that we would do an actual demo, right? So in the first couple of episodes, we kind of set the stage for Mila Health. And then we talked about building the product, building the team. And now we really want to show you the demo. So it's really important. And what I love about this demo, so pay close attention, is that it's a real-time demo. You know, sometimes you see demos of products and it's all pre-recorded. And so you never know if it's truly a demo or not, right? It could be just some magic that's been done. So this is a real-time demo. So with that, I'll ask CEO Shailu to take it away.
Thank you, Ed. It's a pleasure. So before I do the demo, I'll just walk you through a little bit about Mila is an AI healthcare worker that, in this case, Dr. Wiseman can initiate right from his EMR. Dr. Wiseman can personalize Mila. So Mila speaks English. Mila can speak multiple languages. Mila is designed to be persuasive here, and she's trained in a GI knowledge base. And in this case, Dr. Wiseman wants Mila to call John, and Dr. Wiseman can give custom instructions to Mila. And in this case, Dr. Wiseman wants John not to consume sesame seeds and to stop iron pills 7 days before the procedure. And based on that, Mila sets up a multi-day plan to reach out to John, either on phone or text. So this is exactly what somebody in Dr. Wiseman's staff would be doing in reaching out to John. But of course, in this case, it's Mila, and Mila does this over multiple days. So let's give this a spin. And Mila is going to call me now to prepare me for a colonoscopy.
Hey, John. This is Mila from Dr. Weissman's office. Do you have some time to talk?
Yeah, I can talk now.
Great. I understand you have a colonoscopy scheduled in 8 days. Could you tell me what you know about preparing for the procedure?
Just a little bit. I've got the sheet that I got from the doctor, but you know, I don't think I understand all of it. So why did you tell me what I need to do to be prepared?
I'll help you understand the main steps. The first important part is starting a low-fiber diet several days before. Have you begun changing your diet yet?
No, I haven't as yet.
That's okay. Now is a good time to start. You'll want to avoid whole grains, nuts, seeds, raw vegetables, and high-fiber fruits. Stick to white bread, plain pasta, and well-cooked vegetables. Would you like more specific examples?
Not quite. I do wanted to check. I have a constipation issue and I take fiber supplements. Is that all right?
Actually, you'll need to stop taking fiber supplements now. For constipation during prep week, check with your pharmacy about using Miralax instead. Have you picked up your bowel prep prescription yet?
No, I haven't. I was going to do that in the next couple of days.
I'd recommend picking up the prescription tomorrow if possible. That way, you can make sure there aren't any issues with the pharmacy having it in stock. Would you like me to explain how to take the bowel prep medication?
Yeah, I've heard it's quite painful. So why not? Yes.
The prep isn't painful, but you'll need to stay near a bathroom. You'll drink the solution the evening before and morning of your procedure. It's best chilled, and you can use clear hard candy to help with the taste.
All right. Okay, that's fine. What next?
Will you be able to keep your appointment in 8 days? You'll need someone to drive you home after the procedure. Have you arranged for that?
You know what? I didn't know that I need somebody to drive me back. Is that really necessary?
Yes, it's absolutely necessary. No exceptions. You'll be given sedation during the procedure, so driving yourself home isn't safe. Would you like some time to arrange for a ride?
Yeah, but you know, I live alone and I don't know anybody around the area. So what should I do?
This is an important concern that we need to address. We can help connect you with medical transport services that specialize in post-procedure rides. Would you like me to look into those options for you?
Yeah, but is this covered under insurance?
Let me search for current information about medical transport coverage. Many insurance plans cover 80% of medical transport after your deductible. Would you like me to connect you with our patient coordinator to check your specific coverage and arrange transport?
Yeah, if you could please maybe ask them to call me tomorrow because I need to figure this out.
I'll make sure the patient coordinator calls you tomorrow about transport options. Since this is important for your procedure, they'll help sort everything out. Shall we end our call now?
Sure, thank you. So Ed,
Yeah, I
this was
think,
an example. Yeah.
yeah, it's pretty cool. And I like that there's empathy built in, which I appreciate. She listens and she cares and she addresses all the questions. It's pretty remarkable. And I know we're just using a colonoscopy example, but you can do this across all specialties and for various types of follow-up and those type of visits as well. So it's pretty remarkable.
Thank you, Ed. This was a pleasure. And yes, that's a dream for me as a founder of Mila to build Mila such that it can be an extension of a provider's office
Yeah.
and connect with patients, particularly in the context of value-based care, and reach out to ensure that they're keeping up with their chronic care, reach out to ensure that they've done their annual wellness visits, screening on preventable problems that could happen later on, and do this completely automatic in, like you said, an empathetic,
Yeah.
engaged, informed manner.
Yeah, and I see the value of it. We're using a practice example, and I think about my wife as a clinician and running her clinic. But imagine at scale, right? You could put this across the entire health system and the thousands of appointments that might happen on a daily basis, and have these very empathetic agents, doing 90% of the human interaction and maybe saving 10%. I'm making up the number. I don't know what percent it might be, but 10% that are truly, truly unique or require, that extra touch because of, very specific circumstances. So yeah, it's quite remarkable. Thanks for sharing.